to give a keynote and welcome address. Thank you.
Thank you, Tejarani. Good morning. Masigi program masida akoi guidance and counseling ki campaign ama oina ai wa khara ngajana bagi bajaka counseling ri ta hangai ni ta thasari edo baloina hazari ahan bamata da akoi college city principal obiwa mingoina panjara bada ozal kendro program city sabi api bagi mo taram no ocean adu baloina asigi akoi program sigi chawa program logi kadaba expert amadi moderator obiri mingoina panjara bada papa kumbang sanu assistant professor clinical psychology department of rim ahan bamata da taram no ocean galoina akoi na kali gidama program asi akoi na erai arrange tawjabano aibagi tentative oiba ohe khatam ai side gi thumjani maramki akoi kudima problem and issues ye koi kudima themnai adu akoi gi academic oibada yamna common oina thengnari ba problem di stress and anxiety sini asi akoi na akoi gi oza sing chhatra sing da natana oza akoi gi marakta so dum thengnajari bani adu masi akoi na aina panjarabada akoi na COVID-19 pandemic na maram hoitena akoi normal class ta wo phanjadaba oza singa su matam sana knowledge si piba ngamawdaba chhatra singa su oza singa gi matam sana knowledge phangba ngamawdaba dagi asugumba akoi gi issue sing stress and anxiety si thorai ba si kitang tangdu lai ta ba phangna na haidana akoi na gi coordinator obi mingoina panjabada madam konika khurajam amadi akoi gi guidance and counseling gi sengi akoi gi members sing egi nungsidaraba oza sing pullaga sigumba program ama akoi sinjabani aduna madam sidagi akoi na khangba yaba knowledge ke among akoi na khamina si aduga loinana akoi gi program asi gi aroi bada discussion amasung interaction program amasu lejari aduga loinana another information amana akoi gi university and the higher education to women hand fitness skill makada akoi pending machine ama install tawtana guidance and counseling room da hoji laide chhatra sing amasu oja sing ama tuli khudong sa su da bini masi hai in consideration.
Thank you, ma'am. Now I would like to call upon our
opportunity. So today we are going to talk about, I'm going to talk about on the topic stress and management. So I suppose it should be an interactive session, right? So I mean, when this word stress comes, what comes to your mind? Anybody? Stress say, even I'm stressed now. And it's very natural, okay? It's very normal to be stressed. So when this word stress comes, what comes to your mind? Anybody?
Pressure.
Yes, pressure. Anyone? Tension, pressure, right? Talk about it because the current scenario in this current situation, what is more important is like this stress. Because we people are having a lot of problem. We people are having a lot of situation that we are not able to handle, right? So we'll talk on stress. So, right from the time of birth till we die, what happens is that we are exposed with various stressful situations. There are a lot of situations over here. And this modern world, it is said that the wall of achievement is also a wall of stress. And it has been called age of anxiety and depression. Age of anxiety and stress. That's why we are going to talk about stress. Okay, so what is stress? Stress, it is a very normal thing. It is a part of everyday life. So it is the result of the imbalance that is between the demand that has been put on us and the person's ability to copy the demand. So when there is any pressure, any situation that has been put on us, if we are not able to cope or manage, our body react in a certain way. That is what stress is about, because it is a reaction of the body to the pressure that has been put on us. That is called stress. So it is not always the same for everyone, and what is stressful to one person may not be to another person. So the stressful situation that we are talking about, it can be challenging to some person, it can be very stressful to some person, and to some person it may not be. For example, today, I'm coming over here to give a lecture or to give a speech over here on stress or this thing. So I'm little bit stressed, but I have the ability to talk, right? That's why it is not that stressful to me. But for some people who are not very much used to giving this kind of, speech and all, for them what happens is like it is very stressful for them. I don't know. That's why it is very much stressful for them. That's why it is said that it is not same from one person to another person. So an optimal amount of stress actually is good. An optimal amount of stress is good. What happens? What do? You study, right? You organize, you make a timetable, you study. That is because you are stressed and it motivates you and it helps you to get marks. Yes or no? But when this amount of stress is beyond your control, you haven't studied, you haven't organized, nothing happened, then what happened? This stress, it impacts your health. So when I talk about health, I'm talking about both the physical health as well as the mental health. For example, if you don't study the exam, what happened? A lot of stress, right? So what you do is like, you sit in an examination hall and a lot of confusion is there, you forgot everything, right? That is also stress. Okay? Next. So we'll talk about anxiety over here. So here in this first point, it is a subjective sense. Subjective. Okay. So it is very uncomfortable feeling of vague fear and apprehension, which is accompanied by characteristic physical sensation. It is vague in nature. So when I say anxiety means apprehension, fear, but which is not true, which is not fear. That is what anxiety is about. Psychological as well as physiological arousal. So when we have anxiety, what we is like when there's a lot of psychological symptoms over here. We have a lot of worry over here. We have a lot of feeling of dread, right? And another thing is that even we have our physical symptoms. For example, palpitation. You have palpitation when you are very much stressed or when you have anxiety, when you are scared, right? That is what anxiety or stress is about. And this symptom is similar to stress. And you have to remember that in stress, the amount of fear or the pressure, the reaction that we have, it is temporary. In anxiety, it is persistent and excessive in nature, and it is out of your control. Okay? So it leads to nearly identical symptoms of stress, like insomnia. Okay? Difficulty sleeping or concentration, fatigue, muscle tension, irritability. Difference between stress and anxiety. Okay. So generally speaking, stress, it is the reaction when there is a body reaction to stress or body reaction to the physical pressure that has been given to you. And anxiety, in a way, it is the bodily reaction to stress. When the amount of stress continues for a long period of time and it is uncontrollable, then that is what anxiety is about. Talking about stress, why I was talking about anxiety is like, in order to manage our stress, we have to know what stress is, right? And we have to know what are the things that cause stress. And we have to know that whether I'm stressed or not. Okay? So, anxiety, what is a stressor? So, stressor is any situation that provokes stress response. Okay? And it can be an event, it can be a force, it can be a condition that results in physical or emotional stress. So, this stressor, it can be external factor, it can be an internal factor, okay, on the part of the affected individual. Next, please. So, these are the stressor. Okay, so internal stressor we are talking about inability to accept uncertainty. Right. because there was an uncertainty over there. Okay, so we were not able to accept it. That's why we were having a lot of stress. Next one is pessimism. And the third one is, this is what I want to focus about, negative self-talk. What do you do? Like, for example, we have examination, okay. I feel that I won't be able to do it, like I want to score. Negative talk is about. This is something which makes you stressful, okay. And the next one is unrealistic expectation. We all have expectation, and it's a good thing. But we should know that, like, if it is unrealistic, it will create or it will lead to stress. Next one is rigid thinking, lack of flexibility. Next, all or nothing attitude. We see some people, they're having this kind of, if I don't get like 90%, then no, I will not do it. That kind of attitude also, it can lead to stress because it is up and down, right? And the last one is need to always be perfect. Nobody is perfect, right? Nobody is perfect. That's why these are the internal stressor that is inside you. Another one is the external stressor. So the major life changes, there are a lot of major life changes like divorce, okay, that, okay, career that requires you to walk away from home frequently, and even your work at school or relationship difficulties. It can be with anybody, it can be with your friends, your family, you know, your teachers, anybody. Okay, it can be an external stressor. Even financial worries, this is also one of the main external stressor. Because during this time of COVID, we have, there were a lot of patients in our department, because of this external stressor, they were having anxiety issues and all. Being too busy. This is it involves activation of fight or flight response. So let me explain about fight or flight response. For example, you're walking alone. Okay? You're walking alone and there is a dog over there. The dog is barking and about to bite you. What will you do? Run. Yes. Either you run or either you fight. Yes or no? That is what fight or flight response is about. So this particular fight or flight response, this happens when you are stressed. Whether it is a positive stress or a negative stress. Okay? And the last one is it provides energy is provided in proportionate what is needed in the situation. While in distress, you know, it's out of proportion. You are not able to control it. So in new stress or positive stress, the amount of energy you provided is proportionate in nature. Okay, next one. And let's talk about the negative stress. Negative stress, distress. So this is the one that we usually talk about. Okay, I'm very stressed out. You know, today I'm very stressed out. Negative stress never, distress never. But commonly we use as like a stress. So it is very overwhelming, very anxious, and to experience physical and psychological symptoms like headache, tension, insomnia, inattentiveness, and irritability. So frequent intense or chronic stress is toxic to body. Why? And body and the brain, because it is linked to a number of physical and mental illness, and it also impairs the ability of the person. It impairs the function, occupational function or social function, it is impaired. Okay? And people who experience distress tend to feel overwhelmed and helpless, and because they haven't found any acceptable solution, tend to revert to worrying and other productive responses. Okay. So the difference is that where it lies to do with the stressor, the amount of stressor, and how you perceive that particular situation. Okay. So when a person feels confident in the ability to overcome the stressor, they are more likely to experience positive stress. And in distress is caused by when a person assumes that the stressor are not within their control or ability to fix or change. So basically what it means, like the stressor, when you are distressed, it means that like if you should see the stressor, what is the stressor, as well as how you perceive the particular situation, make you feel like whether you are able to handle the stress or not. Whether it is a positive stress or not, it depends on your stressor as well as your perception on or the approach that you see. How you see when this stress is very much excess, persistent, then what happens is like distress, then unproductive in nature. That's right. So how do we respond to stress? So like in order to know whether we are stressed or not, let's see. These are some of the symptoms, okay. First one is the psychological symptoms. The psychological symptoms, it is the difficulty to remember, concentrate, take decision, negative thinking, constant worrying, irritability, inability to relax, feeling lonely, sad mood. These are some of the psychological symptoms of stress. So if these psychological symptoms persist or like it continues for a long period of time and it is affecting your productivity, then that's where anxiety comes. Okay, next. And we will also talk about the physical symptoms. Not only psychological or cognitive symptoms, we do also experience physical symptoms when we are stressed out. Okay, that is aches and pain, digestive problems or symptoms like diarrhea, constipation, increased heart rate, palpitation, right? And decreased libido, it is also one of the symptoms, and shallow breathing and sweating. These are all the symptoms, physical symptoms of stress. Next one. And the behavioral symptoms. We see that whenever we are stressed out, we don't feel like eating, right? And sometimes it happens, okay, like you eat more. It happens, right? It is like extreme, okay. So either you eat more or either you don't eat at all. That is one of the changes in the behavioral symptoms of stress or anxiety. Another one is changes in sleep pattern, where maybe like like you have difficulty falling asleep, or like you wake up in the middle of the night and like you are not able to sleep again. Okay. And another one is staying aloof. You don't want to meet people. You don't want to talk to people. You just want to stay in a room. Okay. This is also one of the symptoms. And another thing is like there's an increased use of alcohol or substance. This is also one of the symptoms of stress. Next one. So coping strategy that I was talking about, we all have this ability to manage our stress. In one way, it can be either a healthy one or an unhealthy one. Okay. So for example, the thing that I was talking about, using of alcohol or using of substance, it is one of the symptoms of stress, but it can be one of the coping strategy also. We also find it one. Like in students and all, like, we find it like whenever they are having stress, they feel like, okay, I'll just smoke once. Does it happen? That is also one of the coping technique, but it is very unhealthy in nature. It is affecting you. Okay? First one, to deal with the stress reaction. When you are stressed, our body react, right? When you are like a lot of pressure, our body react. So in that particular reaction, we can do a certain technique, or we can do a lot of coping behavior in order to reduce the stress. And another one is coping to deal with the stressor, the particular situation. Either you try to, the first one is to deal with the stress reaction, the another one is to manage or deal with the stressor, situation that is giving you stress. Okay, first one. Next one, please. Okay, relaxation is one of the techniques. So like ma'am was talking about yoga, right? It is also one of the relaxation technique that we can actually use whenever we are stressed out. Okay, relaxation means there are many techniques that we use. Deep breathing, yeah, we all do breathing, right? So deep breathing is also, we feel that like, okay, whether it is like useful or not, but actually it's useful. But really it's like adapt, and like whenever you are stressed, it automatically works. Okay, so deep breathing is also one of the techniques. Progressive muscle reaction, relaxation technique. It is also one of the techniques that we actually use, where we are trying to focus on a muscle, we are relaxing our muscle. It's also constricted. So what we are doing in this is, we are trying to relax, we are trying to focus on the muscle, and we are trying to calm our body. That is muscle relaxation. Mindfulness. So mindfulness technique, at the end of the session, I will physical exercise. taking some time to go out for a brisk walk or a run, playing sport, going to gym. These are all the physical activities that you can do in order to fight with in order to deal with the stress reaction. The third one is hobby. Everyone has a hobby, right? Everyone? We have to keep it up. Okay. So sometimes we are so busy and we forget, like, even though I want pancakes, but still we don't do it. But we have to take time for ourselves. Because what is more important is us, me, right? So, situation. To deal with this, so it directly focuses on the problem. So what we do in problem solving, we try to identify the problem. Okay. If it is giving you stress, what we do is we try to identify the problem. We try to come up with many alternative solutions. Then we choose the best one. We go for the another solution. And that's how we can deal with the stressor. And time management is also very important. Especially for the, not only student, everyone, it is very important, right or no? One is changing the thought. It involves identifying the stress-producing thought and replacing them with a stress-reducing thought. For example, my friend don't like me. Okay, because why I'm saying over here, changing the thought is like, when we are stressed or when we are anxious, what happens is that there is a lot of negative thoughts that come up to us. Stress. And it actually, your self-esteem and everything is down. That is very negative in a way, right? So what you can do is, for your own sake, you try to change that kind of thought. You can change. Yeah, I'm beautiful. Everyone is beautiful, no? Everyone, even I'm beautiful, right? No, even though I'm not, I don't know whether I speak well or not, but I think that I'm speaking well. This is how I boost up. Otherwise, I'll be very stressful. I don't know. Quiet time for yourself during the day. You need a time, me time. Me time is important. Okay? Just for to give a few tips. So it is basically what is like paying attention in a particular way. In a particular way, matlab, for a particular purpose, on a particular purpose, staying present and non-judgmentally. Mindfulness matlab staying in present, not being judgmental for a particular purpose. In this classroom, okay? In this classroom, you are on a purpose. Yes or no? Okay. So you are in present. Are you thinking about something that happened in the past? You are focusing over here. You are in the class. You are in the present, right? And non-judgmental. I don't this part, but like if you are non-judgmental, that means we are doing mindfulness over here. Okay, next one. So it is one of the Buddhist way. It is very relevant to our life, and it does not conflict with any of the belief or tradition or anything. It is practical way to notice the way we think, the physical sensation that we have. That is the sensation, this sight, what we see, what we smell, what we hear, everything. Okay, we are trying to focus on it by we noticing what we do normally notice because, or in the past thinking about what we do, what we need to do, or going over what we have done. So why it is very important for us to remain in our present? Because if we keep on thinking about our past or things that have depressed, and again in the same way, if we keep on thinking about the future, which we haven't seen, we keep on worrying about it again and again, thinking about it again and again, we become anxious, anxiety. So it is okay that you have a choice whether you react, you sound it back or whether you tell it very nicely. Okay, then that's the response. Which one is more helpful then? Mindfulness, right? So because if the person shouted at you and you shout, then like what will happen? Fights, right? Then it's better, no, it's quite good. It's necessary. No, then like, we should be mindful. Okay, next one. Skill to help individual to be aware of themselves and their surrounding. It is applicable to any moment of life and it will help in learning and doing mindful activity. It can be anything. While you are listening, while you are doing gardening, while you are cooking, anything, you can be mindful. So the purpose of mindfulness is you have to be in the present. For example, you are doing a gardening. You are in the present situation and you are not being judgmental. You are not thinking about anything else. You're just thinking about how to cut, how to hold the scissors, right? How is the plant and everything. You're just trying to be in the present without being judgmental, without thinking about any past thing or the present thing. Just blocking it and try to be present in over there. This is also one of the mindfulness activity that we can do. Anything you can do. Even you can do the tough boundaries. Listening to this particular program of stress and anxiety. You should know your boundary. And the third one is, territory is this hole, classroom hole, right? And the feeling of boundary is, feeling boundaries. You're happy, you're like, you are eager to know like what's going on, like what the space is about, the talk is about, right? And the last one is a role boundary. This is about me, okay? You can say about yours. This thing. I'm the moderator over here. This is my boundary. I know my boundary. So I'm speaking. I'm mindful. I'm doing mindful activity over here. Okay. So do this thing. You can do your own. Let's see. The time boundary is like. What's the time now? You're present over here. Okay. So what is the task boundary? What is the task over here? Okay. Territory is there. This respected group. Okay. The feeling boundary. You want to learn knowledge, right? And the role boundary is the learner. You are the boundary. Okay. You eat for using your senses. You can use. See, then explore texture while holding it. Let your eye explore every part of it as we have never seen anything before. Okay. By touching it, by looking it, you can see what is it like, how is it like, you can do it. And so we are not a lot of time. So if we bring awareness, we become aware of the aspect of the life that otherwise in yoga also, like we do breathing and all this thing. So what we do is like we sit on a chair or anywhere where you are comfortable and you allow your back to adopt an upright and comfortable position. Gently close your reaction to any threatening or worrying situation. It actually keeps us safe by preparing the body to deal with the danger. If we are not stressed, then like what happens is like you have exam tomorrow and like you are not stressed out at all. Okay, you don't study at all and fail. Okay. So it is good in a way. And another one is that it can manage this. People can manage the stress and anxiety with a technique that I have said, like relaxation technique, breathing, physical activities, and talking about the worries. And worries also, I have said that talk to the person who are not judgmental to me. Otherwise, it can give you more stress. And sometimes stress and anxiety can overwhelm people. And when this happens, it leads to a chronic stress or an anxiety disorder. So when it comes to anxiety disorder, you have to seek help from doctors or a mental health professional because they come up with various technique or various therapy in order to overcome the anxiety or the mental health issues. Yeah, this is about anxiety and stress and anxiety. Next. So be stress free. Thank you everyone. Any kind of problem, any kind of whether it is anxiety or depression or any kind of stress, this is because of the negative thoughts, negative thinking that we have. So, negative thinking, when we have a negative thinking, how do we know?